So let's go ahead and get started. Today, we're going to examine the results of a survey of graduate programs in the US, Canada, and around the globe conducted by CAMI. And this survey was conducted in coordination with AUPHA, the European HealthManagement Association, and the International Hospital Federation. Today's session is co-hosted by the Commission on Accreditation of Healthcare Management Education, also known as CAMI, and the Association of University Programs in Health Administration, also known as AUPHA. Now I'd like to welcome our two hosts, Anthony Stanowski, the President and CEO of CAMI, and Dan Gentry, President and CEO of AUPHA. Gentlemen, please take it away.
Thank you, Mark. Appreciate it. And, I think most of you know who CAMI is and what we do, but the mission of CAMI is really kind of critical. And what our mission is to serve the public interest by advancing the quality of healthcare management education globally. And we do that in four ways. Number one is we set measurable criteria for excellent healthcare management education. And number two, we support, assist, and advise programs which seek to meet or exceed the criteria in the goal of continuous quality improvement. Then we accredit programs that meet or exceed the criteria. And fourthly, we make the information available to interested constituencies, the public, other programs, and students.
Thanks, Anthony. And I want to thank Anthony and all of the team at CAMI for this great collaboration. AUPHA is so proud to continue to be a corporate member of CAMI, and we're really pleased to welcome CAMI as a corporate partner for AUPHA for 2021. And this is part of some of the collaborations that we're doing together, working really closely together. AUPHA is coming up on our 75th anniversary in 2 years, founded in 1947, 1948. And the mission has stayed pretty consistent, but obviously a lot of expansion as well, from graduate programs to undergraduate programs, doctoral programs, and programs outside of North America as well. So AUPHA's mission is fairly simple and straightforward. It's to foster excellence and innovation in health management and policy education and scholarship. And our values include excellence, innovation, collaboration, diversity, and learning. AUPHA last year added a new philosophy statement with regard to how we do our work together and what we're trying to accomplish, with diversity with inclusion at the center of that philosophy statement. And as many of you know, we're in the middle, almost right in the middle of implementation of a new strategic plan that will bring about an Art of Teaching Institute, a leadership academy, a new and improved body of knowledge with 25 domains that will be updated every other year, and a great collaboration with CAMI on a biannual trends report as well. So welcome. So always important to think about why we did this. And Anthony had approached us and his team in the spring. Obviously, by that point, we'd all been in the pandemic for a year. I actually became AUPHA CEO the week the pandemic broke out in the United States. I started on March the 16th. 3 days later, we went fully remote and have remained mostly remote since then. We immediately began to hear that programs were struggling. This was the pandemic is the worst of it is the intersection of healthcare and higher education and academic medical centers to some extent for all health professions. And we tried to think about how to help our programs as everyone was pivoting, as we now call it, or transitioning. And certainly that was the case with regard to going to distance and mostly remote education. But even for our programs that had been mostly distance for several decades, and there are many of them, this was different because of the pressures there. I think we all expected that the undergraduate and the early careers master's degrees students were going to struggle along with the faculty and staff. I didn't anticipate that also our executive students would struggle, even if they weren't meeting every week face-to-face, because they had the added pressures of working 50, 60, 70 hours a week, going to school, and then taking care of kids, and some of them doing distance learning with elementary and middle-aged and high school students as well. So we wanted to see how programs have responded. And I think admirably, Anthony not only approached us, but approached EMA in Europe and several organizations, the International Hospital Federation, which we both have relationships with, to say, can we get some data on this? Can we see how programs are doing and how they have responded? And how can we interpret and use this data with regard to some of our programming and what else we might do for our colleagues?
Thanks, Dan. So what we did was we created a very short 6-question survey, which was really designed to evaluate the impact of COVID-19 on healthcare management education. And we wanted to do it with a global perspective on it. In March of 2021, when we closed the survey, we had 229 responses. Now, most of them, 83%, came from the United States, but really they represented 150 universities from healthcare management education programs around the globe. The sources of it was we CAMI surveyed the accredited programs in the US and Canada, but we also scanned the web and we looked and provided some level of detail on global programs that are doing healthcare management education around the world. AUPHA provided a list of their members to survey as well, and the European HealthManagement Association, as Dan said, participated in promoting and administering the survey to their members directly to kind of avoid some of the irregularities or differences with the European system of sending emails out. So what you see in this image is it depicts the countries where we receive responses. Now, I want to kind of say, listen, this is not a statistical significant survey in any way, shape, or form. We didn't do random sampling. We surveyed everyone that we looked at. What we wanted to accomplish with the survey is, frankly, just to take a rough pulse of where things are in academia around the globe. What we did around with this is we also assembled a panel of leading academics to help guide our understanding of this. And that's where we come in today.
And it's my pleasure on behalf of CAMI and AUPHA to introduce our panelists today. We have Dan West with us, who is chair of CAMI's Global Advisory Council, Nancy Borkowski, who's chair of our AUPHA Board's Global Health Leadership Committee, and Stephen Howard, chair of our AUPHA Global Healthcare Management Faculty Forum, and the most recent chair of our planning committee for our Global Health Management Symposium that we held in June. So first of all, Dan West is chairman and professor of the Department of Health Administration and Human Services at the University of Scranton. He is specialized in international healthcare, globalization, multiculturalism, and diversity management. Dan is the chair of CAMI's Global Advisory Council. It's hard to think about anyone across AUPHA and CAMI with more global experience than Dan West. I always thought of Dan as the traveling man, and before the pandemic, you could always ask, where in the world is Dan West? And he might be someplace differently, given the week or certainly given the month. So welcome, Dan.
Thank you.
Yeah, Dr. Nancy Borkowski is distinguished professor in the Department of Health Services Administration at the University of Alabama at Birmingham. Nancy spent 20 years of experience in the healthcare industry and is a 2-time recipient of the American College of Healthcare Executives, ACHE, Southern Florida Senior Career Healthcare Executive Award, which recognizes individuals who have made significant contributions to the advancement of health management and excellence. Nancy's in her 5th year on the AUPHA board, and as we said, chairs our Global Health Leadership Committee. Nancy's been very involved. So welcome, Dr. Borkowski. And last but certainly not least, Dr. Stephen Howard, who has been at St. Louis University for 10 years and teaches marketing, strategy, and managed care. He is a health services researcher with interest in value-based care, healthcare delivery and payment innovation, and chronic disease, particularly in how those issues transcend borders. Stephen currently chairs the AUPHA Global Health Management Faculty Forum, one of 13 AUPHA forums, and did a remarkable job in leading the planning of our symposium this past June. Stephen has remarkable international experience and interest, and in fact, he's with us today, joining us today from the Netherlands, where he's currently on a research sabbatical and is joined by his family, I think. So Stephen, welcome, thank you.
Thanks, Dan.
Yeah. So I think this is an important place to start. As folks know, neither CAMI nor AUPHA prescribes competencies. I don't think we ever will. We want programs to be innovative, creative. We want them to respond to their student audience, how they're preparing students for particular jobs in different parts of the healthcare industry. And I think we're in sync around that. But then obviously, we want programs to adopt competencies. And CAMI has what most of us who've been involved with CAMI since the creation of this called the buckets in terms of management and leadership and critical thinking and problem solving and communication skills. And so this was important to ask with regard to, as the pandemic became clear that we were in a worldwide pandemic and that we were going to be at it for a while. With regard to our students, and I think our graduates as well, what are the most salient competencies in terms of what's needed for leadership and communication as our colleagues, continue to lead our healthcare organizations across the U.S., across North America, and across the globe. And so, Dan, I think I'd turn to you first to talk a little bit about your perceptions of what competencies were and have been essential for students and for early careers and alumni during the pandemic.
Good afternoon, and thank you, Dan, for the nice introduction. We have been working with the International Hospital Federation, IHF, and I think, as many of you probably know, IHF and the competency platform that they put together, which is quite global, was supported through a lot of work through the American College of Healthcare Executives. In this particular discussion, we're looking at students, and so we again, I think, begin to see how global these competencies are in terms of the impact with students, not only in the U.S., but outside the U.S. itself. We have an ability to talk with students that are out on field work. These are the residencies, the fellowships, to hear about, what's happening. And one of the words that comes back all the time is pivoting. And what that really said was that organizations were moving very quickly in trying to think through and determine how they're going to handle and manage. And many of our students were involved in a lot of these quick changes that were being made within healthcare organizations. Wonderful experiences, although the outcomes, sometimes were very difficult for families and people who were hospitalized. But again, in talking with, faculty members who are also supervising these fieldwork placements, here again, we have heard about how organizations, have had to redesign the workforce very quickly, how they had to adapt to technology access issues that came up with ventilators and, what was available for critical care areas within organizations. We heard discussions on diversion, where hospitals, healthcare systems were overloaded in certain areas. So this critical thinking and analysis really came into play as a very important domain for our students. And of course, that was then followed because in the residencies, fellowships, and other placements, our students were out there working with senior executives. We're privy to sit in on meetings, that were involved. And so this whole idea of patient safety and security within the healthcare organization and issues related to stress and long hours where people are working, again, senior management teams had to create huddles to work through these types of issues. And I think, our students, not only here in the US, but globally, were exposed to some very key executive decision-making that had to be made in order to manage. So the whole idea of being able to communicate effectively within the organization became quite apparent. And as we see in both the ACHE competency model and the IHF competency model, leadership, communication, personal relationships, critical thinking, and business skills become extremely important. So I'm going to end there with that as kind of an introductory comment about the type of leadership response that was needed, during this period of COVID.
Thanks, Dan. The next question is this is a very complex slide to kind of look at, but let me kind of give a little background onto it, which will help kind of make sure that it's a little more understandable. So the question that we asked in the survey was related to how were the programs handled? What was the modality of the program prior to the pandemic, during the pandemic, and what was the expectation post-pandemic? Again, what would the expectation be when the pandemic would end? So we asked program directors to kind of ask about that, and we asked them about that for how the modalities would be. Now, pre-pandemic, if you take a look at the slide, the first box on the far left says 24%. And that means 24% of the program said most of their program was delivered online. 17% is a hybrid model, partly online, partly face-to-face. And again, prior to the pandemic, 59% of the respondents said our programs were delivered mostly face-to-face. Now, during the pandemic, as was expected, we saw an incredible shift occur. We saw that it go from 24% fully online to 87% fully online. 87% fully online during the pandemic. 11% said a hybrid model would be involved, and only 1% still continued with mostly face-to-face during the pandemic. So a very small percent, but still 1%. Now, the expectations post-pandemic was the fascinating one, because what we saw there is that we saw fully online kind of rebound to 27% or go down to 27%. But we saw face-to-face drop to 33%. So post-pandemic, the programs we surveyed said only about a third of them would go back to mostly face-to-face. The difference is the hybrid model, where we see that go from 17% down to 11, and then up to 40% expectation post-pandemic. So those were the numbers that we saw. So my question to, the thought that kind of came up around this is, when you look at these changes occur, a lot of people initially thought, well, poor students during the pandemic, they didn't get the education that they needed. And some of the discussions that came out from other folks we talked to basically said, perhaps it's lucky students. They got an even better education during that time, one that kind of challenged them to go out and figure out how do they gather and assimilate knowledge during a period of incredible upheaval that challenged their whole way of learning and maybe will help prepare them more in the post-pandemic world. So it's an interesting perception that's kind of changed over that period. So Nancy, I'm going to kind of ask you around this. What do you see as being the most significant impact of this change? With the move to more online content versus in-person content, does that represent a different way that students will get their education? What do you see the implications are?
Okay, well, first of all, I want to thank both AUPHA and CAMI for inviting me to join the conversation today. And, when I first saw the results of this survey, I thought, it was interesting, but maybe not as surprising as what we thought, And I really, I kind of see it as like 3 points here, this movement that we see from the traditional to the hybrid. And I guess maybe we should clarify, what do we mean by hybrid? I'm interpreting hybrid as students will come on campus for maybe a short period of time, maybe a week in a semester, and then the rest of their learning is online, versus what some others might talk about a blend, a blend being, you have simultaneously students remote, online, and in the classroom, and you're trying to teach to both groups at the same time. So I'm not talking about that group. I'm talking more of what I had described with the students coming in for like a immersion schedule type of thing on a semester basis or quarterly basis, whatever the case. So I didn't, as I had mentioned, I didn't find it as surprising, because I think for the first thing is, first let's look at faculty, okay, versus the students. Faculty had a whole year of really learning and teaching, maybe sometimes very independently. How do I deliver this knowledge to the students remotely that I might not have really been interested in before, or that I just didn't have the skill set necessary? So everybody kind of stepped up to the plate and, wasn't just slapping up the syllabus and saying, okay, we're going to do a Zoom meeting every week. We really had to think through, how do we deliver the content we want to deliver to these students creatively, using, various softwares, and I think Zoom was probably one of the most highest used. So I think first the faculty started to have a comfort level with delivering the content online. And then with our students, I think it's what we're seeing in the workplace. They're not any different. They want flexibility now. They want to have choices of either being in the classroom or being online, a combination of the two. And then I think that we might have looked at this to say, this traditional way that we were delivering, because we really want to get the students immersed in the whole social experience of being on campus and creating cohesiveness within their cohorts and so forth. And I think the combination of all three of those, I think we're starting to see, we can do this. We can meet everyone's needs and deliver a very quality education to our students. My also question too, as I was thinking through these results, what is that traditional classroom going to look like now? I don't think we can go back to, okay, I got an hour and a half of class and I'm going to throw up my slides and we're going to talk through this. It's going to be very interesting to hear, are those traditional classrooms like really being flipped, and to where the students will, we've watched your lectures in the past, we can gather all that information. When we come to campus and have our face-to-face classes, what do we want there? We want more of that active learning going on, that problem solving, that group work, that engagement, that peer-to-peer learning happening. So I'll be very interested to hear how that has changed, as well as the delivery mode of the content that we have. I was also very interested, I guess maybe just looking at the results, you end up with more questions than the results that we have, is to really kind of think about, were programs already thinking, even pre-COVID, that they were going to start to move into a different method? Did they start to maybe realize that their programs could have a far reach than just their geographic areas, or students having to relocate to the city where these programs were? So were they already considering this, and then the pandemic just accelerated the decision-making that they were going to have? Did universities really step up to the plate and put the resources into developing the technology and the support that faculty and students needed to be able to learn well in this new environment that we were in? The very small differences that you see from we were totally online and we're going to continue totally online, those are programs who have been teaching very, very well, in that space. It was really that traditional to that hybrid, which we're going to really have to wait and watch and see what happens. I know here at our universities, we have basically gone back to, if we were hybrid, we were hybrid. If we were traditional, we were traditional. So it'll be interesting to hear from our audience, or what movement have they seen as well. So I'll kind of stop it there. Those are my thoughts when I first saw this slide. And again, I'd love to hear from our audience when we get to that point.
Thanks, Nancy. It's almost what I'm hearing you say is a spark. I mean, some might call it a tipping point, but kind of the significant change that's really causing a reevaluation of the approaches.
Mm-hmm. Absolutely.
Steve, I want to kind of introduce the next slide, and Steve's going to comment on this one. What we asked in the survey was, how many of the programs felt they were challenged in placing students in real world experiences? And those would be, internships, fellowships, practicums, other type of real world experiences that occur within the degree. And not surprisingly, we saw 58% of the programs that responded said they were challenged in finding experiential learning for students as internships or fellowships or et cetera. And during this period, I actually had some communication with Steve, and he was telling me about the problems that SLU had with it. But what was fascinating were some of the opportunities that kind of arose during that, and exciting ones. So, Steve, I'm going to ask you to talk about some of the things that you saw happen at SLU.
Sure, thanks, Anthony. I imagine, like a lot of you, we have that same experience. All of a sudden, our customers, mostly health systems, are in a pinch, budget pinch, lockdown for anyone who wasn't essential staff to have in facility at care facilities. And so, we all saw that precipitating to internships or fellowships being canceled, or when we were lucky, moving online. And we saw that, as I reflect back now, really, I think a surprising number were able to maintain face-to-face. And I think, as you saw on the previous slide, it was in the neighborhood of half, right, that we were able to maintain in that in real life, IRL. Sorry, I've been hanging around with my 11-year-old too much. And so IRL, right, in real life, face-to-face experiences. And as I look at one of the sessions from June, from the annual meeting, and it was a really good session between Baylor, MUSC, UNC, and SLU. And they talked about how sometimes those were some of the more non-traditional kinds of settings and small hospitals, especially early in the pandemic when the rural areas weren't affected as much. They were able to kind of pick up some of the slack as far as taking these in real life, face-to-face interns. And that was our experience at SLU as well. And the check mark is to indicate, yeah, of course, we'll continue with that in the path moving forward. What we had really never had before, or almost never, was an internship, but that was happening totally remotely. And I think that's probably for a lot of you. And we saw a significant portion of that other half of internships going to that kind of space where it was Zoom meeting or Microsoft Teams every day, all day, for the full amount of hours for the entire summer, in our case, summer internships. And, it was great because we did see some of the internships from before, rather than just cancel, they were willing to be flexible and work with our programs to ensure that students could still get the learning experiences and just do either all of it or most of it in that online format. And if you want to click one more time, that's to indicate, I think this is something that we'll try to promote increasingly moving forward. And I think there are a couple of places where it could fit as we think about, especially the corporate type roles in our health systems, insurers, other places where the role is not direct caregiving. We're all asking ourselves, Dan talked about this with AUPHA, we're all working virtually. Why not? Now we've learned how to do it. We were forced to learn how to do it. So there are probably a lot of situations where we can do part. And as an example, we saw quite a number of students in internships where, depending where they were and when they had a flare up in that area of the country, they may have started face-to-face, and then there was a wave and they went online, or vice versa. You know, they started off online and then they were able to go back face-to-face. And we saw that in both 2020 and 21, that kind of a thing evolved. And so I think that's something we'll retain as we put together proposals with corporate partners for integrative real-world experiences for students. And then the third path that we had to, I'd say had to, I wasn't a fan, and we had to put together for a thankfully small number of students that were kind of displayed in that pie chart, where we couldn't get even a virtual internship arranged. And so what we did was compile, if you will, some experiences for students where we were able to take a project with this hospital, a project with that alumnus. And I have to say our alumni really stepped up to help solve this problem for a small number of students. Where we acted as almost like the hub, connecting a number of projects, trying to find themes through them that made sense for the learning experience and the competency building experience for students. In one or two cases, those needed to include like an applied learning project with the faculty member who was studying something that was very applied. And in the student, in that case, that was one of the multiple modules that were in the student's summer experience. I put that as a red X because I think it's suboptimal. It's not what we really want for them, but it's at least a learning experience for all of us as programs that when you have to, you can pivot and make things happen. Another thing I didn't note here as explicitly that a lot of the internship or other real world experiences were not paid. And historically, we would have liked them paid. And I know a number of universities, Forrest Kim at Baylor talked about how they were able to use a special fund they had in the program, in the department, to be able to help provide some additional funding for students. I think SLU was able to do a couple of those. And because that really was a hardship on so many of our students, if there was a blessing that came along with the virtual space. So a financial hardship for students in the past has been, oh, I'm on a 12-year, feels like that, 12-month lease on my apartment in St. Louis, and now I have to move across the country for an internship and pay double rent for 3 months. And so we saw much less of that happening. And that's, I think, an area where we've got maybe a non-traditional student with family concerns, et cetera. And historically, they would have said, well, I just can't leave St. Louis for my internship. Now we can come up with opportunities where they can still take a great opportunity. It's out of town, but if it can be made virtual or largely virtual, they don't have to pass it up. They can still take care of their other, family and life complexities and still take those opportunities. In addition to, I've kind of focused on the internships and residencies, but so many of us have real world integrative experiences in our classes or in the program, then maybe a capstone that spans multiple courses or specific course projects. And I think in this case, the pandemic was really helpful because, as we kind of heard before with Nancy, it forced us to make changes and adaptations that perhaps we should have made some time ago. And I think that reflecting on my own, for example, some projects that I do that are for industry partners, like business planning, strategy, marketing planning projects in the community, we've always done them. They were largely in class, but we had generally a kickoff meeting at the partner's place of business. The teams would maybe have a couple, 1, 2 more face-to-face meetings with them throughout the semester. We couldn't do that, so it all went virtual. And I think one of the benefits of this will actually be if increasingly our clients, if you will, our industry partners, have the opportunity to do all the experiences virtual. It's less intrusion on their schedules. It allows us to go more broadly throughout the country or even international. And it just makes it a lot easier when whether it's pandemic or other kinds of basic public health concerns, we can do that. And it's also easier on students' schedules. So a subcomponent there, we saw that at least initially, it was a little harder to get some projects because more people were, as Dan said, working 60, 70 hours a week and just couldn't handle one more thing. And they saw it as an addition to their work lives rather than help. And I think one thing is that we can do is communicate to partners on these projects that these are intended to be a help, to take some work off their plates, and then ensure that we build them in such a way that we can deliver on that. Those were kind of some basic observations that some others with whom I've spoken and we at our university had those experiences, and just wanted to share those.
Great, thanks, Stephen. So I think this is the last slide before we want to open it up and see if our panelists have any additional comments, and then all of our audience as well, questions, discussion, comments. I think that this is the slide that all of us that organized the session are most cautious about, maybe most uncomfortable with. It's really early to be looking at this data, certainly not the real time with regard to this past spring, but moving forward, I think. So I don't think it's a surprise that where you see in the red there, the programs that had a decrease of either more than 10% or some decrease, but less than 10%, that there is that 31% there for the reasons that we've already talked about. If I was an undergraduate student who had been thinking about graduate school for several years, and I might have wanted the whole experience, so I might be putting off graduate school for a year. Or if I was that executive that Stephen just talked about, who is entering a new cohort in one of our executive programs that CAMI accredits and that AUPHA, has as members, I might be thinking, I can't work 80 hours a week during this pandemic and start a degree at the same time. So I think we're in that liminal space, that in between period there. And remember the timing here, and Anthony's been great about reminding us about the timing. This is this past spring. So it was looking back. What I'm hearing, and I would invite our panelists to share and anyone in the audience, with the exception of a couple of our AUPHA graduate programs, and we have about 155, 160 total graduate programs. I haven't talked to all of them, but talking to a lot, is that there's been a bump. It's been called the Fauci effect by some. The public health schools already have data around this. We're second only to epidemiology in terms of the bounce for this fall with regard to health management and policy. And from what I've heard, except for two programs that are either maintaining or down a little bit, is that everyone's up, that applications were up, the quality was good, acceptances were up, and that the cohort sizes are up. In some cases, significantly up. Programs that wanted 28 to 35 and have 55 cohorts in the program. Now, is that sustainable? Is that going to continue? Does this mean that we're more attractive now because people see the opportunities in terms of giving back and being passionate about leadership in healthcare organizations and healthcare management? It's too early to tell. So I would ask Dan and Stephen and Nancy first to comment about this, and then let's see what any of our participants have to say as well. And also Anthony, I know that CAMI will have great data on this. AUPHA and CAMI collect data. AUPHA surveys are voluntary because we're an association. CAMI has full response rates. So CAMI at some point will have great data on this. So Dan, Nancy, Stephen.
Yeah, if I can just offer some observations and in terms of what we were seeing. And number one, and maybe others who have experienced this, we saw differences in online versus residential. The online was actually increasing during this period of time, during the COVID time. And that was good to see, but felt the same stressors that were alluded to earlier in terms of very long work weeks. And therefore, the only change we really saw was limiting the number of courses they were willing to take during this particular period of time. The face-to-face, we found students really embraced coming back. These were younger, very different from the older students who are out in the workforce, in the online, are out there frontline workers, et cetera. But we also found that being able to come back into the program face to face was very attractive for some of the students. One final note I would make, we began to see difficulties with global admissions. Where they were really having difficulty accessing visas. And even if they did, with all of the quarantines and the change in the level of the countries, we actually had to open a special cohort because people were delayed 3, 4, 5 months. And we had 10, 15 students that wanted to start the program. So we had to make some accommodations, one-time accommodations to do this. But the timing didn't work the same with academic years, at least in our situation. Just those 3 observations.
Okay. Dan, I also have 3 observations I'd like to kind of share. The first was that, which I was very surprised on. I thought our executive programs, whether our master's or our doctoral programs, we would see applications decrease. And I was very surprised, but we maintained, and I think we even bumped up a little bit there. And I would ask the students, how are you managing all of this? And they just say, you do what you have to do, and I've got good staff back at the hospital or the nursing home or wherever they may have come from. So I found that to be very, very interesting. The second part I would like to mention is, because I saw in the chat people were talking about students and the non-tuition costs, and they were like they enjoyed saving that, there's always a balance to that. So, with the students not saving on the non-tradition, the other costs that are associated, okay, the university is not getting the revenues from residential housing. They're not getting it from parking. They're not getting it from food and so forth. And so I'm cautious, and I'm waiting to see how the next 2 years budget cycles go with our universities. Plus, they've had to put a lot of money into technology for this switch to online and hybrid and so forth. So I'm very curious on how those universities are going to be able to balance that. And then third, because this was a global survey, there are some countries that don't recognize online or hybrid, that their degree, unless it's the face-to-face minimum 40 hours of contact, that degree is not valid. So, whether those countries start to change with their ministries of education as to whether they will recognize some of these online and hybrid forms is also going to be very interesting. And I think those are just open questions that we're just going to have to wait and see.
We had similar experiences to both Dan and Nancy. Enrollment tended to be, well, we filled our cohort, right? So we were still up, and we had the similar kind of challenges. I think where we needed, I think related to what Nancy said, we needed flexibility with current students. So in addition to students coming in, thinking about the executive cohort, there were people where they got slammed and their work week doubled. I remember one student saying, we have to rotate who gets a full 8 hours of sleep each night. So it was so bad. And we found that we were regularly making some kind of accommodations, like Dan talked about, in this case, that students could take short leaves of absence from the program. It's a little easier. Our executive program design, the courses are sequential rather than concurrent. So it's easy to just say, I'm going to disappear for a month and I'll catch that class up maybe next year, or 2 classes, whatever it was. And so that was one way we were able to accommodate the flexibility students needed to avoid dropping out, but still ensure they were making some progress in building the competencies.
Dan, let me just add a few comments. And you know, it's been interesting. Like you said, our CAMI's annual report right now is in the field. It will close sometime in November, and hopefully we'll have some results from that pretty shortly after that. But you know, from people that we've talked to and the programs we've talked to, has been interesting. So, for example, Johns Hopkins University, which became very well known during COVID because they were putting out the projections worldwide about the impact of COVID-19 on mortality and morbidity and incidence rates and the like. Their admissions just jumped right off the board. Their applications, I went to them, they've seen incredible growth in their program. And, you know, we're able to kind of, I don't want to say take advantage of COVID-19, but to kind of use it as an opportunity to really kind of grow their program and how well their program's known. We've also seen some programs struggle during that period, and they tend to be programs that haven't really fully kind of embraced what was going on and trying to kind of leverage that to kind of show why there's an importance in healthcare management and healthcare management leadership in that process. So it was a very interesting dichotomy in there that we saw among some of our programs.
So I did see a few questions here. Stephen, there was a question for you, a follow-up question. Let's see. Oh, did you have to increase engagement with preceptors for the virtual experiences that you talked about?
We had always had engagement throughout the summer internship. And so that really just changed formats. You know, we used to be able to physically go and meet with people at their locations. And of course, 99 to 100% of that all moved to virtual. But the point is that is essential, ensuring that you don't just leave that to chance, that you're actively engaged in the relationship your student has with the preceptor throughout.
And then there's a question from our colleague, Tom Martin. One question I have is on asynchronous offerings, but challenging to do right and with a focus on quality compared to IRL, face-to-face, hybrid, and online. Those all have synchronous components. Any comments there with regard to, you know, personally or your faculty, colleagues?
I'll throw in, I think that's where those regular preceptor communications are important. So in addition to a faculty member meeting with the preceptor, we also had periodic surveys of the preceptor and the student. So we were able to keep a gauge as the summer went along, how it was progressing, ensure that projects were getting done, that the student was figuratively or literally showing up, you know, to get the work done. But yeah, the point there is you can't just be passive about that.
And then any more general findings or perceptions with regard insights in terms of asynchronous teaching in general, not just internship teaching? I mean, I know that we have tried to help with everything we can at AUPHA in terms of, you know, early on in the pandemic, we began to collect cases, and I think we've got almost 30 at this point. The case competition folks were fantastic in sharing those because those were seen as a possible substitute for experiential. And then we've tried to offer additional webinars around how to engage students, how to switch things up if you're online for an hour and a half to 2 hours.
Yeah, you know, and I also found that, you know, we were all very supportive of one another. You know, if we found something that worked well, we were the first to share that with others. And so they could see if it would work for them. I think the shout out when we needed, you know, guest speakers to come in, because again, you're trying, you know, if you're online for 2 hours, you know, you're trying to break that up and put the students doing case studies and so forth. So when we talk about the quality, I think it was definitely there, you know, whether you were online or you were face to face, it was just, you know, how good you were with using the technology to communicate that. So, and I think we just got better and better at it as, you know, the months just went on, and each semester just kind of rolled into each other. So, and there was one comment in the chat. I really want to, I'm sorry, I don't remember the name when they said, so when will the post-pandemic, when will we start that? And, you know, and I think, again, that's a very big question. When will we even know that we're there? You know, only time will tell, and our hindsight will be 2020.
I saw a question in the chat,
Yep.
and Chris Calkins, I saw
Yep.
your face just kind of pop up now. It regarded the number of students in non-traditional settings, hospice, home health, long-term care, nonprofits, and advocacy. You know, the question, and it wasn't really kind of addressed within the survey, is, again, was this a tipping point, not just for the modality parts, but also for a way for students to really kind of think about more than hospital administration as part of where my career goals are. And we've actually seen, CAMI has a chart where we talk about the placement of our students, and it's only something like 42% of students get placed within a hospital or a healthcare system. The other part of those percentage of those students are going into long-term care, consulting, physician group practice management, insurance, pharmaceutical, and the like. And we all know how that's changed pretty dramatically over the year, but this might be the opportunity for students to really kind of see there's more to hospital or healthcare administration than hospital.
Yeah. Anthony, there's also a question from our colleague, Chris Johnson at Louisville. Really interesting question. I think there was maybe less change in our post-pandemic teaching delivery, but big change in how we use technology to make classes more action-based. And I think, Anthony, this is a question for you and Dana. Did the survey look specifically at overall technology use changes post-pandemic?
Yeah, no, we did not get into that question specifically, but you know, we did ask them about what percentage of their modalities would kind of switch around there. A little more detail within some of the questions that we saw in there as we kind of grouped them, but we did not ask specifically about the technologies that they would be looking at. Good question, though.
We've got a few minutes left. Any other questions? You can open up you can turn off your mute button if you'd like to ask a question or you have something to offer.
Something I think Chris Calkins mentioned, that as far as the alternate sites for the integrative experiences, love that. And as he said, important that we ensure that we're getting the right competency building in those alternative locations.
Mm-hmm.
I have a question. I would like to know whether how did faculty react to coming back either in hybrid or in face-to-face teaching?
I'll start that discussion. I was so happy to be back on campus. I really missed engaging with the students. I came back in the summer and it took me a little bit of time just to get acclimated back in there. And in the fall, of course, our residential students came on campus, and I'm loving it. You know, I think the students missed it and I missed it as well. And I think my colleagues did as well.
Yeah, I would have to echo the same. We found our faculty really were glad to be back in the classroom and back with one another in the office and being able to interact and have the kind of camaraderie that was there. Another area that I want to mention that's been impacted, at least for us, because we operate global partnerships and study abroad. And boy, that came to a real quick stop. Still is very difficult to predict because of the changing leveling across countries. And so it's been hard to maintain some of these global partnerships. I mean, at least we can use Zoom and things like that, but the face-to-face is really dropped off significantly. Makes it hard for, you know, programs that specialize in global healthcare management.
Did you perceive it was different in Brazil?
Well, some faculty people are still afraid of going back. And in some places, students have been COVID positive after coming back?
Anthony, before I close, you want to say anything? Any additional comments?
Dan, just, thank you very much for this partnership and making this happen. I mean, this whole concept of this survey that we did, if it weren't for some of the impetus and the advice and direction that you gave us in this process, I don't think it would have been anywhere near as successful as it was. So appreciate all of your support in making this happen and in bringing this to your programs.
Thanks, Anthony. The feeling is mutual. I want to thank those on the CAMI and AUPHA staff, in particular, Dana and Jason and Mark and Jamie, for all of their assistance in getting this set up. And thank you to our panelists, Stephen and Nancy and Dan. So this has been a great discussion.